good morning, Reagan. My name is Suzanne, and I'm going to be your primary care provider for today. I just want to get your consent that it's okay with you that we video this examination for today.
Yes.
I'm going to wash my hands. And I heard that you're here for your physical exam. You had some, especially here for your neuro test. Okay. So first, what I'm going to do is check for the cranial nerve. So we're going to check for cranial nerve number 1, which is olfactory. So I would ask the patient if you can close your eyes, and then close your eyes, closing one of his nostrils. Can you smell this? What is it?
Coffee.
Okay. And then the second one, close your eyes. Can you tell me what this is?
Cinnamon.
Next is I'm going to be checking his cranial nerve number 2, which is the optic nerve. I'm going to ask the patient to hold the Snellen's chart and hold it up. Can you read the smallest letter?
LT.
Closing your one eye.
LTFPH.
Okay, and do the other one.
LTFPH.
Okay, thank you. And then next, I'm going to be checking for his retina, so using a fundoscope. So with his right eye and my right eye, checking. Okay. And then also on the other side, everything seems to be good. Okay. And then after that, I'm going to be checking for cranial nerve number 3, oculomotor, number 4, trochlear, and occlusans together. So what I'm going to ask the patient is if you can look up straight, okay? Don't move your head and just follow my hand, okay? Okay. Then tell me when you can see my fingers. Okay. And then I'm also going to be checking for pupillary reflex directly and concentric, so using a pen light. So if you could, yep. Okay. Okay. Checking for reflexes. Okay. And then now I'm going to be testing his cranial nerve number 5, which is trigeminal nerve. So I'm going to be stroking your cheeks. Tell me if it's dull or soft. Okay, so if you can close your eyes.
So.
Dull or
Dull.
sharp?
Dull.
Dull? Wow, okay.
So.
Next, I'm going to be checking cranial nerve number 7, which is the facial nerve. I'm going to ask the patient, can you wrinkle your forehead? Can you puff your cheek? Okay, and next I'm going to be checking cranial nerve number 8, which is the acoustic nerve. So I'm going to cover one of his ears, and I'm going to say a word and tell me if you can hear it.
Baby.
On the other ear.
Baby.
Next, I'm going to be checking still acoustic nerve using the Weber's test, so using a tuning fork. Tell me if you can hear it. Okay, equal on both sides. Now for the rinse test.
No.
Can you hear it? How about now? Okay, and on the other side. So testing for bone conduction and then air conduction. Air conduction should be longer than bone conduction. Next, I'm going to be checking for cranial nerve number 10, vagus and glossopharyngeal together. So I'm going to ask the patient to open his mouth, stick your tongue out and say ah, and also check for swallowing. Can you swallow? Yes. And now I'm going to be checking for spinal accessory cranial nerve number 11. So can you shrug your shoulders? Okay. Go against pressure, up and down. Okay. And then next, I'm going to be checking for cranial nerve number 12, which is the hypoglossal. So using a tongue light, I'm going to ask the patient to open his mouth and then check, open your mouth, check the tongue is midline, and also check for stretch using a tongue blade. Move back and forth. The tongue blade, making sure that tongue has good strength. Now I'm going to be checking for cognition. So I'm going to ask the patient some questions. Reagan, can you tell me when your birthday is?
February 5, 1983.
Okay. Do you know where you are?
Yes.
Where are you right now?
Chance in University of United States University.
Okay. You know who is the president right now? Who is the president of America? Okay. Now, while talking to the patient, I'll also be assessing his speech. Then I can tell that it's not slurry or anything like that. Now, I'm going to be testing for his memory. So, Reagan, I'm going to be telling you 2 words and try to remember them later on for later. Okay, I'm going to ask you again. Okay?
Bird box.
Okay. Now I'm going to be testing for his reasoning. So I'm going to ask him, like, if there was a fire, what would you do? At your house, if there was a fire, what would you do?
Run.
You would run. Okay, that's good. Now I'm going to be testing his cerebellum. So I'm going to ask the patient to stand up. And then I'm going to be testing his gait. So can you just walk for me back and forth? Okay. And then backwards again, walk. Now can you walk like with your 1 foot in front of each other, if you can do that. Okay. Walk on your heels. Walk on your toes. Okay, good job. Okay, thank you. And now I'm going to be testing for Romberg's test. So Reagan, if you can just stand, close your eyes, extend your arms straight up. Okay, close your eyes. Then now I'm going to be testing for what's that called? For drift. So closing his eyes, checking for pronator drift. Next, I'm going to be testing for rapid alternating movements that he can follow. So Reagan, if you can follow me, do this. You can also sit down if you'd like. Can you do that? Okay. Then next, I'm going to be checking if he, can you remember the 2 objects that I told you? Okay, good job. Now with, I'm going to be doing the test called stereognosis. So Reagan, close your eyes. Okay. Open up one of your palms. And then can you tell me what this is?
Paper clip.
Okay, good job. Now testing the other hand. Reagan, can you tell me what this is?
Cotton ball.
Okay. Now checking for graphesthesia, I'm gonna draw something on your finger, on your palm, and let me know what number this is.
2,
Okay, on the other palm.
2, 3.
Okay, very good. Now I'm going to be checking for motor strength with the upper extremities. So for the deltoid, okay, deltoid on the other side as well. And then I'm going to check in for triceps, okay, and also for the biceps. And then also now I'm going to be checking for hand grip. Checking for hand grip. Can you squeeze my fingers? Squeeze my fingers tight. Go. Finger strength. Okay. Open. Span your fingers against pressure. Okay. I'm going to try to both sides. And then check for lower extremity strength for his quads and hamstrings. So I would ask the patient to lay flat on a bed and check for abductor and adductor muscles and compare them on each side. Next, I'm going to be testing for sensory system. So Reagan, can you close your eyes? Okay, and tell me if it's dull or soft. I mean, usually we would ask for if it's dull or sharp, but I do have a cotton ball, so it's soft. Also be doing that on the lower extremities as well. And then also test for any type of vibration sense that he can feel as well. Now I'm going to be testing for reflexes. So using a percussion hammer, I'm going to be checking his, checking for biceps and triceps. Also on the other side, and also for on the other side, and also checking for the patellar reflex. So usually the patient's feet should not be touching the floor. And then also for the Achilles, testing that on both legs, and also checking for Babinski, forming like an inverted J on the sole of his feet. Okay, and that ends my neuro exam. Thank you very much.